And we're on the air in 3, 2, 1.
Speedy TV. Live from Paralyzed Veterans of America's Health Summit.
Delivering excellence, achieving state-of-the-art healthcare.
About 4 years ago, we decided to do this event as a single entity. We believe that within 6 or 7 years, we'd be able to make this self-sufficient, because what we're doing is a great thing, and we know there's a lot of people that want to support that cause. Having the Acting Undersecretary for Health, Dr. Clancy, coming to speak shows how the VA thinks this is an important meeting, and they're supportive of us and the things that we do. And I want to say that we've had a short working relationship with her, but we're very pleased with everything that we've had and asked her to do. She's accepted the challenge and worked tirelessly to get done what we need to get done. Part of what makes this summit such a success is that we ask for feedback. And when we get that feedback, that helps us decide what topics we need our hot button topics and need to be brought forward. And so the input from the people that attend the conference is extremely important to us.
It's a great pleasure and honor for me to be at the PVA Summit. This is I've been at all 4 of them, and I've been a speaker at all 4 of them. This is a wonderful opportunity to bring together physicians, nurses, therapists who are committed to improving the care of veterans with spinal cord injury, multiple sclerosis, and ALS. It's a unique opportunity to bring together these healthcare providers who are dedicated to treating veterans, so we can share ideas, become better informed, so that we can return to our veterans hospitals and improve our care. And each year the summit has gotten better and better.
Well, the great thing about doing a summit like this, where you bring clinicians and therapists and professionals in the spinal cord injury medicine community, is we're in a time now when a lot of things are changing in the VA healthcare system. A lot of these people work in the VA healthcare system. A lot of them want to do the right thing, but in times of great change, you have to have people come together and exchange ideas and find out what the best practices are. Part of the problem is the VA spinal cord injury system of care is really unique, and there's not a lot of there aren't systems out there globally that share the same characteristics. And so because it does a great job, and because it's been the benchmark, this has to be a place where we gather together and exchange ideas and get the best information in the interest of moving ahead with spinal cord injury, research, education, finding a cure perhaps, all those types of things. Everywhere, every presentation I sit in, a lot of great questions, and that tells you that the audiences are engaged. The speakers are passionate about what they do, but the best evidence that this works is when these people go back to their respective hospitals and clinics and areas where they work, they're doing even better. And they're taking those great ideas they've gotten here, taking it back to where they work, and implementing a lot of the great things that we're hearing about here. So I think the best feedback is in the way that care gets better and better each year as we do these summits.
It made me feel validated. I was happy, I was excited, I was surprised when I got the email a couple of weeks ago. But it makes me feel validated as a clinician, because we always wondered, did we do enough? Could I do more? We're always feeling like, did I do a good enough job? So at least for today, I feel like what I do has been beneficial and has been validated. I really enjoy coming to the summit. This is the 4th year in a row that I've come to the summit, and I've actually presented at 2 of them now. And I find that it's energizing and invigorating. I've been in SCI now for almost 10 years. And when I leave here, I always have a new idea, a new thought about how I might change my practice, add something to my practice. I find that my practice doesn't get stale if I come and get energized every year. And I already have my new idea for this year.
I love coming to the summit because people who are really on the ground helping people with spinal cord injury are here, and they're eager to learn. They're eager to grow. They really care about patient care. And when you're in an environment like that, it just brings out the best in people. So I really appreciate being able to share in that.
I keep coming back because I learn a lot from all the good speakers, the good topics that are really applicable to the population that I serve, which is the spinal cord injury patients. So I think every year I might keep coming back because I really learn a lot. It's good to learn, if there's any current practices that they're doing that's more effective than what we're doing in our own clinic or site. So we try to share information, network with these colleagues, and learn from them as well.
I think the summit has been outstanding. The speakers have been wonderful. The attendees have been good. There's been good interactions. I have very much enjoyed the topics. It's been great. Very relevant to my practice and to what I do. And I've tried to kind of gear towards MS a little bit more. And so it's nice to have the opportunity to pick the topics that might be more relevant for you. So I've kind of leaned more towards the MS topics.
This is my first summer. I've been a VA employee for about 12 years now, but this is the first time I've come to the PVA. I think the value of this is quite high, and it really brings together all the different types of practitioners. The doctors tend to be sort of siloed amongst the doctors, perhaps the nurses with the nurses, and this brings all of them together. It's nice to see things actually concentrated that are relatively unique, especially for spinal cord injury patients.